Okay, so create a new tab and type DrugBank, and you will get this result. Just click on the first one, DrugBank Online, and you will get this interface. Is everyone on the same page? Okay, cool. So now we know that we have under this drugs drop down, there is target, there is pathway, there is indication. So today we are going to look at what this indications option is. So indications is nothing but it can be symptom, it can be a disease. For example, drug is prescribed for a particular disease or a particular symptom. For example, if it is a painkiller, the painkiller drug is prescribed to suppress the pain. Am I correct? So indications is something which will uh, basically tell you the indications of the disease, like what does a particular disease or a health condition indicate, so that a particular drug can be administered. And have you guys heard of ibuprofen? Yeah, can you just search that here under drugs? Just search ibuprofen. Hope the spelling is correct. Yeah, so we get this, and if you click on pharmacology, there is a section called as indication. Am I correct? Now you have a whole paragraph written about for what are the conditions for which this ibuprofen is used. Here it says dental pain. It is used to manage acute and chronic orofacial pain. The pain related to face and mouth region, and they have specified that under dental pain. And then they have also mentioned the use of high dosages of ibuprofen has been proven to decrease inflammation and decreasing polymorphonuclear cell influx in the lungs. So, in case of cystic fibrosis, it is also one of the genetic health conditions to suppress or to decrease the inflammation and also to decrease polymorphonuclear cell influx. This is something which you can look into if you're interested. I think we also study this cystic fibrosis in medical biotechnology. I'm not sure if BTech students are having that course, but in MSI, there is an option to choose medical biotechnology under electives. So in that, we did study the cystic fibrosis. And also you have rheumatoid and osteoarthritis, which are very famous diseases, and a lot of research is being done. And there is one more, patent ductus arteriosus. So you have a description written after the title, what exactly the drug, for what conditions the drug is being used. And it's a short section under pharmacology. And you have also written investigational uses. It just means that the effect of ibuprofen has not been proved. It is still under investigation. They are testing maybe like different doses of ibuprofen at different stages of these diseases to check if it can work or if it can be a good drug in treating those diseases: Alzheimer's, Parkinson, and breast cancer. Did you guys understand what this indication is? Okay, now it is time for us. So, this was a part of the output that we got when we searched the name of the drug directly. So, it was a short section under pharmacology. Now, we will come back to home page. Just select indications and write pain. Maybe like I want to know what are the drugs that are used to treat pain. So I'll just write the name of the symptom, pain. And you have got 855 results, different indications. So it kind of works like there are lot of indications. If the word pain is written in the title, or if anything related to pain is in the title, you will get that in your search result. Without clicking on this, you have already got a list of drugs that are used to treat pain. So it is not specific again. So you have got a broad list of, drugs. You have got, just check, caffeine is also there to treat pain. And then ibuprofen, search for ibuprofen. Yeah, ibuprofen is there. Did you guys find it? Yeah. And you have different pain. So there is non-specific pain, there is chronic pain, acute pain, pain with burning, there is cancer related pain, and then there is gastrointestinal pain, so etc. So if you click on any one of these, let's just click on chronic pain. You can see morphine, which is a drug again, uh, and ibuprofen is not here in the result. If I click on the chronic pain, I get this result. There is a unique ID related to the title, that is chronic pain. Then you have synonyms of the chronic pain. So you have a lot listed here. And if you just uh, scroll down, a lot of drugs that are used for treating chronic pain are listed. There is drug name, and then there is a drug description. Basically, this amphetamine is a central nervous system stimulant and also sympathomimetic agent indicated for the treatment of attention deficit hyperactivity disorder. So this is also used to treat ADHD. And after that, you have a target section, and then you have the name of the targets, and then you have a label basically present after the name. So there are few which have target as the label, and there are few which have transporter as the label or enzyme as the label. And your homework is again to find the difference between what does this first line mean when it says that a particular sodium dependent dopamine transporter is a target, and why does it not say the same for cytochrome P450? Are you guys able to understand what I'm trying to say? There is a common target column, but they have different labels for different targets. So your homework is to understand what does these mean. And then again, there is only 10 entries being shown because that is the filter that has been applied here. And again, it is same with all the other things. You have different drugs and the targets. And if you scroll down, there is a clinical trial section. Everyone got this clinical trials. Okay, now you have an identifier, which is nothing but an ID that is related to a particular clinical trial. And you have the title for the clinical trial. If the clinical trial is listed under a particular drug, that just means the clinical trial is related to that drug. It does not necessarily mean that, this, uh, for example, what I'm trying to say is, as this is the chronic pain page, all the enlisted clinical trials deal with chronic pain or something related to chronic pain. And again, it does not mean that all the trials have used a particular drug. There can also be clinical trials which are not involving any drugs. For example, investigation of grip strength, pain, and anxiety levels in dentists. Are you guys able to understand what I'm trying to say when I'm saying that It need not be a drug included clinical trial. Hello guys, are you able to understand? So, just go to the next page. Yeah. So you can see here, when I went to the second page, there is again a clinical trial enlisted, MI VET scan cannabidiol CBD care trial. And for this clinical trial, under the drugs section, drugs column, they have enlisted this cannabidiol drug. It just means that in this particular clinical trial, this drug was tested, and that drug was tested for treatment of a particular symptom or a disease, or maybe in this case, the chronic pain. Are you guys able to understand? And again, there is a phase column which it can be not available if it is not having any data related to the phase of the clinical trial, or it might have clinical trial number. For example, this ID and the data that it holds is related to the phase 2 of the clinical trial of this drug. And the one which I'm highlighting now is the data related to the clinical trial phase 3. Hope you guys understood. I think there are a lot of clinical trials that were done related to pain, especially chronic pain, and you have 2067 entries. And you have the title of the um, clinical trial, and then there is something called as purpose. So, there are different types of drugs that might help you in preventing a disease or a symptom, drugs that might help you to treat a particular symptom when symptom is already present. And then there might be also drugs which are used for supportive care. They're not taking the lead, they are just assisting in the care. Something like minor drugs. Are you guys able to understand? And let's just look at few of these. This is important. Under status, this is something that we have to know. Under status, you have different options. And unknown status means the status of this clinical trial is not known. As simple as that. And if it says recruiting, I think you guys will agree with me that for a clinical trial, they use volunteers. So it is not like they force people to join a clinical trial. It's more like they open, not exactly a Google form. This is just to make you guys understand. It is more like they might have some eligibility criteria for a particular clinical trial, and they will just say whoever is interested can enroll yourself to this clinical trial. And if that is the status, if they are actively looking for participants, it will say that the status is recruiting, and the phase of clinical trial is third, and the purpose is treatment, and this is the title. And if you click on this, I think you will get more information related to the clinical trial. And if it says completed, it just means there was a recruitment, and the study was done normally, and after that the data was collected, and it's like the normal. It started, it went, and then it completed. Are you guys able to understand these two, recruiting and completed? Okay. And now there is something called as active not recruiting. It just means that this clinical trial is not under suspension, or not under investigation. Sometimes what happens is, there might be a clinical trial uh, which got permission, then they suddenly discover that there might be some severe negative effects that could happen during the clinical trial. Then suddenly they get suspended or they withdraw. So in that case, you will get withdrawn as the status. But if it is not belonging to any of those conditions, it is just not recruiting participants, but it is active. So in that case, you have got this as the status. And if we just um, look at few other options, I'm not sure if they're available for this drug. Yeah, so there is one more called as enrolling by invitation. So this is more like not everyone was allowed to participate. It was more like uh, they selected individuals, and only those who got selected were invited, and they participated in the clinical trial. Are you guys able to understand? Okay. And now there might also be few other things. Okay. So there might be something called as not yet recruiting. It just means that the clinical trial study was approved, but they have not started recruiting participants yet. And there might also be something called as withdrawn. So, withdrawn is when, before even participants could enroll for it, the clinical trial was withdrawn. So, that is something what it is trying to say. And then there might also be something like terminated written under the status. So, terminated basically means the participants' enrollment happened, but because of some safety reasons, they stopped the study at early stage. Are you guys able to understand? And then you might also get suspended under the status. So that just means the study is like, under temporary halt, and it might resume later. It is more like, when they find something uh, unsafe or something suspicious, sometimes these regulatory bodies they might hold the clinical trial for some moment until all the things get clarified, and then they might again resume the trial. So that is what it is trying to say. So regarding a particular symptom, you can get to know the clinical trials that are happening and the status of the clinical trial and the phase of the clinical trial. It is not that it is having everything for a clinical trial. For example, for the first one, so there is for the second one, it says not available. So it is not like, it has all the data, but it does have some data related to clinical trials. And if you just click on this, let's see what is there. So there is a website called as clinicaltrials.gov, and you have got this, and I think you guys can go through it. See, if I want to download this clinical trial data, I have got the title, URL, status, and summary of the trial, result of the trial, the conditions, interventions, and also the outcome measures, who are the sponsors for the clinical trial, collaborators, age. Again, you have a lot of information here. But the only thing is, you might not get participant details because those are kept uh, because of safety reasons. They don't release those details. It's like if I'm enrolling myself for a clinical trial of a drug, my data is not disclosed. So the max to max, like what you can get is you might have a column called as participant one or some ID of the participant, but you will never get the actual name or like address, etc. Only you will get age, gender, and all these things. So did you guys understand what's happening? As it says, it has more than 32,000 characters. Oh, sorry. Excel will incorrectly open CSV if it has more than 32,000 characters. So maybe the file that we're trying to download has a cell where there are, more than 32,000, or it may not be. So you guys can look into it. And one more thing that I want to let you guys know, usually even in ML, whenever we were working on a data, the preferred format was CSV. Am I correct? I think almost all the data sets that we used, it was .csv. But even JSON file format, it is widely used uh, in IT, in software, to store the data. And you again have, you know, even in Python, there is a procedure to deal with JSON files. You can extract the data again. We can look into this one as well. Even in Kaggle, if you go, you can get data in JSON format. You can specifically mention in the search that you want JSON data so that the search results will be in JSON format. And this was all about DrugBank. Did you guys understand? I think we covered a lot of things related to DrugBank. Yeah. What do you guys say? Like, should we go like this? I mean, like covering every component of the website, or just, um, look at one or two important ones and then leave the website? Because there are a lot of different websites, right? Like, we are going to continue this boot camp even once the sem starts. So I want to know how you guys want it to go. Can you guys let me know? Okay.